Have you ever seen an old man in his 70s walking every morning, smiling, saying, "I'm fine, nothing to worry about"? Or perhaps someone in your family, looking healthy, eating normally, but a few months later, suddenly hospitalized? It's more common than you think, because at an older age, many dangerous illnesses come quietly. No pain, no fever, no obvious symptoms. Most elderly people think they're fine, yet their bodies may be sending subtle warnings we tend to ignore. And often, when it's noticed, it's already too late. In this video, I'm going to share with you 8 surprising signs in older adults that may look normal, but could be hidden symptoms of serious health issues. These are insights based on real medical studies, but I'll explain them in a clear, friendly way, so you can apply them right away for yourself or your loved ones. So stay with me, because even one small sign could be the key to saving someone's health or even their life. Sign number 1. Looks healthy, but losing weight without trying. You might be eating well. You sleep fine, move around the house with no problem, and even take walks in the morning. But then, the scale starts to drop. Little by little, the weight goes down. And maybe you think, that's okay, I'm just getting older. It's good to be lighter anyway. But here's the truth. Unexplained weight loss in older adults is not something to ignore. It could be an early warning sign of digestive cancers like colon or stomach cancer, type 2 diabetes that's slowly developing, thyroid problems like hyperthyroidism, or even malabsorption, where your body no longer absorbs nutrients properly. Doctors often say, by the time we see noticeable weight loss, the condition might have been developing quietly for months. So if you lose more than 4 to 5 pounds, 2 kilograms, in a month without trying, please don't assume it's just age. Talk to your doctor. Get some simple tests, blood work, thyroid check, maybe even a digestive scan. A gentle reminder, if you notice your clothes feeling looser or your arms looking thinner, even if you feel okay, that could still be your body trying to tell you something. Sometimes the quietest changes are the most important to pay attention to. Sign number 3. Still cheerful, but memory is quietly slipping. Many older adults seem perfectly sharp. They tell great stories, remember birthdays, and chat with the grandkids like always. But there's one small change. They begin to forget things that just happened. Like asking the same question again and again, misplacing keys or glasses, struggling to find common words. Most people think, that's just normal aging, right? But sometimes it's more than that. It may be an early sign of mild cognitive impairment, or even early-stage dementia. What to watch for? Repeating questions or stories, getting lost in familiar places, trouble finding words, feeling confused doing daily tasks. If you or someone you love shows 2 or more of these signs, don't wait. Talk to a doctor. Early support can make a big difference. A gentle reminder, when someone forgets, don't get upset. Be patient, kind, and supportive. Because memory isn't just a brain issue. It's part of how we connect, love, and care for one another. Sign number 4. Sleeping enough, but still waking up tired and drained. You sleep 7 or 8 hours a night. No tossing, no turning, no staying up late. But when morning comes, you wake up feeling tired. Your body's heavy. Your mind feels foggy. Most older adults think, well, that's just part of aging. I'm used to it. But sleeping long doesn't always mean sleeping well. This could be a sign of age-related sleep disorder. Sleep apnea often goes unnoticed. Mild hypothyroidism, or even early signs of depression in older adults. When to take it seriously? You feel tired all morning, even after a full night's sleep. You have low motivation, feel sluggish, or mentally cloudy. You get irritable for no reason. These may seem minor, but over time, they can deeply affect your physical and emotional health. A gentle reminder: if your body rests, but your mind doesn't, the sleep isn't truly healing. And sometimes, better rest starts with someone simply noticing and caring enough to ask. Sign number 5. Skin looks fine, but frequent itching or small rashes keep appearing. Some older adults have skin that still looks good. It's not bruised, not dry, not discolored. From the outside, they seem perfectly healthy. But then, they start itching frequently. It might be a tingling or prickling sensation, especially in the evening or at night. No obvious rash, no allergy, no new food, but the discomfort just keeps coming back. Many brush it off as just dry skin or a change in weather. But persistent itching in older adults can signal something deeper. It may be linked to mild liver dysfunction causing toxin buildup, early-stage kidney issues where waste products irritate the skin, diabetes-related skin changes, or side effects of long-term medications. Pay attention if itching lasts more than 2 weeks, happens mostly at night, comes with fatigue, loss of appetite, or changes in urination. Ask your doctor to check liver, kidney function, blood sugar, and medications. A gentle reminder: don't ignore the itch just because it's small. Sometimes the body doesn't hurt, it itches to get your attention. Catching the quiet signs today might prevent something bigger tomorrow. Sign number 6. Feeling tired or out of breath with light activity. Even if you're still moving well, some older adults still move around just fine. They shop, sweep the yard, cook meals, fully independent. But then, after just a few stairs or a brisk walk, they feel tired, out of breath, maybe even a little dizzy. It goes away with rest, so it's easy to ignore. But in truth, this could be your heart or lungs asking for help. This symptom often relates to coronary artery disease, restricted blood flow to the heart, early-stage heart failure, chronic anemia, or low oxygen levels due to lung conditions. When to take it seriously: if breathlessness happens repeatedly during light exertion, you feel winded after simple tasks like climbing stairs, you notice racing heartbeat, mild chest tightness, or unusual fatigue, a simple ECG, blood test, or heart ultrasound can detect problems early. A gentle reminder: many older adults say it's just age. But aging shouldn't steal your breath so easily. When effort feels heavier than it should, it's time to check in. Sign number 7. Mood swings or irritability. It's not just old age. We often think of older adults as calm, wise, and understanding. But sometimes they seem different. They snap more easily, get frustrated over small things, or withdraw from family time. They may lose interest in hobbies, stop calling friends, or just sit quietly for hours. And many families say, that's just how people get when they're older. But the truth is, sudden mood changes in older adults can be signs of emotional struggles, even depression. It could be linked to mild to moderate depression, chronic anxiety, loneliness or grief after losing a partner or retiring, or side effects from long-term medications. Pay attention if they become easily irritated or unusually withdrawn, lose appetite or have trouble sleeping, seem emotionally flat or disconnected from life. This isn't just aging, it's mental health needing care. A gentle reminder: mental health matters, just like heart health or lung health. So if a loved one starts changing emotionally, don't blame them. Sit beside them, talk a little longer, ask a little deeper, because love and attention might be the best medicine of all. Sign number 8. Skipping checkups because I feel fine, missing the window to catch problems early. Many older adults say, I feel fine, I eat, sleep, and get around. No need to see the doctor. And truly, that's exactly why so many serious health issues go unnoticed. Because in older age, many illnesses don't show symptoms at first. No pain, no fever, no obvious discomfort. But slowly, silently, something begins to change. Some of the most common silent conditions: high blood pressure, type 2 diabetes, high cholesterol, early-stage cancers, mild liver or kidney dysfunction. These are usually found only during regular checkups, not when symptoms appear. Why early detection matters? Because treating early is always easier. Because some problems only show up in lab results or scans, not in how we feel. A kind reminder: don't wait until something feels wrong. Checkups aren't for when you're sick. They're to help you stay well. And in later years, proactive care today can make all the difference for your tomorrows. We've just gone through 8 small signs, so small they're easy to miss. No pain, no panic, and on the surface, everything looks fine. But for older adults, these small signs are often how the body whispers, "Please pay attention." The question is, are we listening? Healthy aging doesn't have to be complicated. It's not about taking a dozen pills or living in fear of every little thing. It's about being mindful, being proactive, and treating yourself with care. If this video helped you, please share it with someone you love, a parent, a grandparent, a friend, because sometimes a simple message like this can be the start of a longer, healthier life. Thank you for watching until the end. I'll see you again soon for more simple, heartfelt conversations about aging well and living fully.